How's it going, guys? 9-year-old boy. He's got a 2-day history of left hip knee pain. Recently recovered from an upper respiratory tract viral infection. No past medical history. Vitals normal. Looks like count normal. 9,000 should be 4 to 11,000. He's able to bear weight. Physical exam shows no erythema. Warmth of the left hip. There's mild tenderness, palpation. BMI 23. Question just wants to know the most likely diagnosis. Now, I'd say pass level if you're studying for 2CK pediatrics. If you're studying for step 1, some of these diagnoses, you're probably like, what the fuck? Okay, don't really know what to tell you. Okay, you gotta know these differentials. So let's just hop through. Choice A, Legg-Calve-Perthes, wrong fucking answer. This is idiopathic avascular necrosis of the femoral head. Idiopathic, okay, meaning we don't know the cause. If it's sickle cell is the cause, if it's Gaucher, if it's corticosteroid use, it's not Legg-Calve-Perthes. So this will be a 5 to 8-year-old, classically, who's got left hip pain, okay, and they're not going to mention a viral illness as associated. And what they'll classically do is tell you x-ray shows a contracted femoral head. Very buzzy, the word contracted. If x-ray is negative, a bone scan can be used to diagnose. It shows up on one of the 2CK forms. Wrong fucking answer. Choice B, primary hip dysplasia, wrong fucking answer. It's going to be a kid under the age of 1 who has clicking, clunking on the Ortolani-Barlow maneuvers. So what they want you to know is that you're going to do ortho-referral. Sounds wrong. Referral, right? But ortho-referral, if it's listed. If it's not listed, you're going to choose ultrasound under the age of 6 months, x-ray over the age of 6 months, and then the treatment is going to be Pavlik harness, P-A-V-L-I-K harness, aka abduction harness, as it can show up in the USMLE. It's a frog leg appearing harness. And they can write the answer as poorly developed acetabulum. Okay, so for each of these diagnoses, we can write them as descriptors. We could have written avascular necrosis of the femoral head, and that would have been like Legg-Calve-Perthes. We could have written poorly developed acetabulum as primary hip dysplasia. Choice B, wrong fucking answer. Choice C, septic arthritis, wrong fucking answer. So, I mean, this one is pretty easy to eliminate. You do not have leukocytosis. There's no rubor. There's no color. Okay, let's be sophisticated, use the Latin, right? So, I mean, he's got a bunch of negatives for septic arthritis, even if you're not sure of the exact findings. I mean, clearly you would expect things like an elevated leukocyte count. You'd say, oh, that sounds really sinister, sounds really bad. He can't bear weight. There's redness, there's erythema, right? Wrong fucking answer. Choice D. And I should just mention that septic arthritis of the hip is pretty rare. It's not impossible, but I mean, it's just not a typical location. Wrong fucking answer, as I already said. Choice D, slipped capital femoral epiphysis, wrong fucking answer. He's not in the age range. Okay, so this is going to be classically 11 to 14-year-old overweight boy with a painful limp. That's your classic demographic. 4 out of 5 questions. Okay, and they'll tell you x-ray, or they'll show you the x-ray is an ice cream slipping off the cone. I have this in my MSK PDF, which I'll link below, right? Very, very buzzy. So overweight, pre-adolescent boy, 10, 11 to 14, with a painful limp. It's 4 out of 5 questions. Now, of the 1 out of 5, that can be broken down into 2 1 out of 10s. So 1 out of 10 will be, they'll tell you the BMI is 20, and you're like, what the hell? I thought the kid had to be overweight. I agree with you, but they'll show you the x-ray of the ice cream falling off the cone, so it's hyper obvious. You can eliminate to get there. And then the other one is they'll just give you a kid who's like 13, and they won't mention BMI at all. And just based on the age alone, you can diagnose it because, as I already said, things like Legg-Calve-Perthes would be 5 to 8. Wrong fucking answer. Choice C, toxic synovitis, aka transient synovitis, correct answer. So this is going to be viral infection causing hip pain. Okay, so this is transient inflammation of the synovium of the hip. You say, why did I mention knee pain? I mean, as I've talked about, you can have hip problems that have referred pain to the knee. And if they want to be very tricky, they can even occasionally give you knee pain without any hip pain. Okay, so just be aware of that referred pain possibility to the knee. And this is hyper pass level for 2CK peds, as I said, because viral infection plus hip pain in a kid is toxic synovitis. And you use ibuprofen, not aspirin, of course, to prevent Ray's syndrome, but ibuprofen is an answer on one of the NBMEs, ibuprofen or acetaminophen. And they'll give you some negatives. The two important negatives to differentiate from septic arthritis is number one, you're not going to have leukocytosis, and the child will be able to bear weight. So those would be classic, as I already discussed, as I already inculcated. If we had leukocytosis and we said he can't bear weight, sounds sinister, that would push us more towards septic arthritis. But toxic synovitis, it's an important differential you have to be aware of. Correct answer. You know the deal. I'm going to make more content. Be like my stuff, subscribe and share. Appreciate your time. That's it.